today we're going to look at a couple of key themes that emerged during open enrollment in 2017. The first that we want to spend a little bit of time on is around this idea of employee choice. Employee choice is alive and well on the benefit-focused platform, and in fact, consumer-driven healthcare is as well. 60% of large employers on the platform now offer at least one high-deductible health plan. And Logan, what surprises you from a plan design perspective?
Yeah, well, despite what I guess you could call the dwindling threat of the Cadillac tax, employers are still looking to cut costs on their health plan, and HDHPs are a great way to help them do that. Last year, we saw that 52% of our large employers on the platform offered at least one HDHP in addition to the traditional PPO, HMO, EPO, et cetera. This year, that number's bumped up to 56%, and then when you add the 4% that have gone full replacement, offering HDHPs exclusively, you see that essentially 3 out of every 5 employers are offering HDHPs now, so they're definitely taking hold.
And Jessica, does it surprise you that 40% have yet to offer a high-deductible health plan?
I don't think so. I think a lot of it has to do with the geographic dispersion of your associates, the culture within your company, if you're a more paternalistic culture, if you have unions, manufacturing, and just that overall competition that you're dealing with, whoever is signing up for HDHPs, if you're seeing that in your local market or within your industry, you're more likely to follow suit. Retailers, restaurants were more early adopters, and so we see a lot more in our space. But I think it still goes back to that overall culture and giving folks choice.
And you introduced the HDHP or CDHP program or plan design in 2011. Mm-hmm. What advice would you have for those in the room who perhaps haven't offered one yet and are thinking about it for 2018?
Really, the biggest message is communicate early and communicate often. And if you attended the HR Market Tech, which was a completely sold out crowd in there, they had to bring in extra chairs. There's some great resources that are available. You have to have a multimedia strategy because you won't get that message out in one piece. As the folks at Benefit Focus told me, it's called snackable content. Yes,
I think Logan gets credit for that, not me.
Yeah.
Joan D'Amico.
All right, so Joan said it earlier as well. But I think having those bites of information and having it available in the moment that someone's trying to use their plan when they're signing up for the first time, and then continuing to push that message throughout the year is really a mission critical option. You can't stop at the end of open enrollment and not say anything until next October. You've got to keep that message alive and well throughout the year.
And when you do dip your toe back in, what are some of the investments you'd make from a communication perspective to improve?
So I think what's interesting about benefits, I think a communications firm said, take a look at your overall benefits spend and then look at how much you spend on your benefits communications. And for us, we spend millions and millions of dollars on healthcare each year, and we spend less than 0.5% of that budget on communicating those very important benefits, helping our associates to be better consumers and helping them to really appreciate and value what's available to them. And so you really have to have that year-round communication plan. I know I keep going back to that, but Erin, I'm gonna call her out again, she maintains a communication calendar, and we hit on multiple topics throughout the year. We use all sorts of communication media, from videos to what's called a mobile wallet card. So it's outside of our firewall, but it's links to all of our benefits that you can click on. It's got all of our videos, all the phone numbers, all the group numbers. It's a super easy, accessible point that we're constantly sending them back to. We're pointing them to very specific communication opportunities. The Benefit Focus platform is branded dswbenefits.com. We are the DSW Benefits team. That's how all of our emails come out. We have a very targeted brand so that everyone knows it. When you get your open enrollment materials, you know it's coming not just from DSW, but from DSW Benefits. So we have that ongoing messaging so that they look for them. And not only do we have that communication plan throughout the year, we're very targeted and specific. So we take a look at, who would be best targeted for an infertility benefit. Who are the tobacco users on our plan? Focusing an email communication to those folks to encourage them to use our tobacco cessation programs. Those kinds of things we try to utilize to avoid some of that fatigue, that burnout, that ignoring our messaging, since they already get so many emails. But we use texting. I'm sure we use lots of other things, but that's what I can come up with right now.